Hi, Dr. John Torres here with NBC News on this Facebook Live. Friday, the end of the week here. I want to go over headlines that you've probably heard over the past couple of days, get a little behind those headlines and give you a better understanding of what they actually mean, and particularly what they mean for you and your family, and how you can use that information to hopefully keep yourself safe, but also help end the pandemic sooner rather than later. And then I want to take questions you have. So please, if you have questions, send them our way. I'll get to as many of those as I can. But starting off with the headlines, I'm going to talk about a couple of things. One, going over numbers, because the numbers have jumped a little bit, and I just wanted to demonstrate and highlight just what's going on right now in this new surge we're having across the country. Number two, we're going to talk about deaths that have been happening and what they're calling excessive deaths and what exactly that means. You might have heard that headline. And then masks. There's some new information out about masks, when you should wear them, and who's actually wearing them at the time right now, and what can happen if more people wear them, how that can actually benefit all of us. So let me start first with the numbers themselves, just going over numbers. So according to NBC, and we keep our own stats, and the stats we make sure we verify as best we can, there was a new high number of daily cases, and that was the day before yesterday. The number of cases, 77,640 cases. That is a new number. I'm sorry, that was yesterday, the 22nd. A new number. Looking at it retrospectively, the number before that, the highest recorded number before that was July 29th. This is since the pandemic started. July 29th, there were 75,723. So now we're at 77,640. So this is a couple thousand higher, a couple thousand higher than it was even back in July. And so what that is showing us is that even though you might hear some people saying that we're almost out of this, we're rounding the corner, whatever words they use, we're not. And by one expert's opinion that I heard, he said, which I think is appropriate, that we're coming into our darkest period of the pandemic. The next 6 to 12 weeks is going to be extremely important. So the next month and a half to 3 months, think about it. We're the end of October, November, December, January. That time frame, which are our winter months, are going to be extremely important. And they're probably going to be, as he said, the darkest period of this pandemic, meaning we're probably going to see a lot more cases. We're going to see a lot more things happening. But looking at those numbers, overall, so far since the pandemic, almost 8.5 million people have gotten coronavirus. Granted, some of that's because we're testing a lot more, but also you look at positivity numbers, you look at hospitalizations, you look at actual cases. Yes, there are more people with coronavirus now. Deaths, 224,000 plus deaths. That right now, if you look at it, and sometimes people say, well, if you look at deaths, we're a big country. We're one of the biggest countries in the world. And so, of course, we're going to have more deaths. But if you look at the deaths by 100,000 people, in other words, how many people have died per 100,000 people in your country, we rank fifth. And we rank fifth behind Peru, Brazil, some other countries that are out there, some smaller countries, and Spain being one of them as well. So it's showing that, yes, even though we're a big country, we have a large number of deaths, our death rate is much higher than a lot of other countries, especially a lot of larger developed countries. And so something to think about. The 7-day average right now is 62,000 cases, and that seems to be going up. And here's what we think is happening. Originally, what some experts, including Dr. Fauci, had talked about is during the summer, we were hoping we could get down to a baseline of 10,000 cases a day. That 10,000 cases a day would tell all the public health experts, hey, our measures are working. We're doing the things we need to do. Both public health officials, government officials, and people themselves are doing the things they need to do to help keep it under control. And then we can start preparing for what we're going to call, the winter surge that is going to happen. And we knew this winter surge would happen because this is the way these types of viruses work. Number one, they're more active in cold weather. Number two, we go indoors more, so we're closer. We're not social distancing as much. And then number three, if you think about it, in these cold months, we have runny noses, we have coughs, we have sneezes. These are ways the virus can travel and get to other people. So that combination means that we knew that in the winter months we would start having more cases. Well, sure enough, again, we've reached this record of over 77,000 cases. Problem is, we never got to that 10,000 a day baseline in the summer. And we never got that respite where we needed to kind of regroup and start doing things. If you want to call it a wave or a surge or whatever, they kind of blended into each other. The concern here now, especially with the flu coming upon us, is that we're going to have this twindemic, some people are calling them, but we're going to have an overload of our healthcare system. A lot more people are going to be getting sick, and unfortunately, people are going to die as well. So we need to make sure that we do what we need to do in order to get things under control. Now, one thing to remember, And even though we have this high rate and these high numbers, there's a 2-week lag in what happens today as to what the results will be 2 weeks from now. And everything happens in sort of 2-week increments. So let's say you get infected today. You might not be positive for 2 weeks, or even start showing symptoms for 2 weeks. It might be a week, but more, let's say 2 weeks. So you might start seeing symptoms in 2 weeks or start testing positive in 2 weeks. Once you get to that point, then 2 weeks later, hospitalizations tend to fall. So people tend to get sick at about a 2-week period. 2 weeks later, they tend to get hospitalized. And unfortunately, 2 weeks after that, the deaths follow. So what we do today, we're not going to see results for a couple of weeks. And so sometimes people say, I'm doing everything right, but these numbers are not going down. Why do I even bother? Because what you're doing today is going to impact what's going to happen over the next 2, 4, and 6 weeks, and particularly cases, hospitalizations, and deaths. And that's the important part to think about. Now, speaking of deaths, the next one I want to talk about are the excessive deaths you might have heard about. The CDC just came out with an estimate starting in January, when we first started hearing about coronavirus, up until the beginning of October. They're saying that there were almost 300,000, as a matter of fact, a little over 299,000 excessive deaths compared to years in the past. And here's what they mean. They looked at years in the past, that same time period, January to October, and said there's a certain number of deaths. Then they looked at this year and they said, okay, we have that number of deaths, but we have almost 300,000 on top of that. Now that is COVID or COVID-related type deaths. Now the COVID deaths themselves, from our numbers we were just showing you here, we're talking 224,000 deaths. So there's almost 80,000 deaths that aren't COVID deaths, but are what we're calling COVID-related deaths. And the reason they're calling it that is because these are deaths that people typically have because they didn't go to the hospital for reasons they might have gone to in the past. Let's say somebody has chest pain, somebody has stroke symptoms, somebody has cancer that needs treatment early on. They didn't go to the hospital, especially in the spring, because of the concerns of getting coronavirus. And granted, back then, there was a lot of concern about going to hospitals. The hospitals were overrun. We needed to keep those facilities for COVID patients. And so some people got the message that maybe I shouldn't go even if I'm having issues. Well, if you remember, a few weeks after that, a lot of medical organizations started putting out the word, hey, you still need to come to the hospital. The hospital were basically isolating COVID patients, putting them in separate parts of the hospital. It's a safe place for you to come. You need to come if you're having heart attack symptoms, if you're having stroke symptoms, if you think you find something that you're worried about might be cancer or you need screenings. There are reasons to come right now. And so the message here essentially is that, hey, keep an eye on yourself and your health. Realize, yes, we are in a pandemic. We all need to be safe, but that doesn't mean you need to neglect your medical care. And when you look at the actual statistics, what we're seeing here is that it's affecting all racial and ethnic groups much higher than the whites. But the problem is Latino groups tend to be even higher, and they're over 53% excessive death rate increase in the Latino population. So particularly for that group, but for others as well, getting those medical needs taken care of, even in the middle of the pandemic, is extremely, extremely important. And so that's the excessive deaths part of this whole thing. Now, the last one I want to talk about are masks for a few reasons. Number one, the CDC just came out with some recommendations for masks. And what they're saying is that masks now, as opposed to before, where the word was kind of out, that you need to wear masks if you're out and about and you can't socially distance. Well, now what they're saying is you need to wear masks in public places or public transportations. They don't mention social distancing. And I think the reason they're changing that is because sometimes it's real hard to gauge how much space do I need. Is this 6 feet? Do I need to be more 12 feet? Because we know the virus can spread beyond 6 feet, even though we use 6 feet as the beginning measure for social distancing. So the best bet is to make sure that you end up getting that social distancing. You end up wearing that mask, because that combination is what's going to help you. The IMHE, the ones that do most of the tracking and the modeling for us, that talk to us about what's going to happen as time goes on here, they actually are looking at it here. And I'm looking at the statistics right now. And what they're saying is when they observe people, 59% of them are wearing masks. Even though the majority of people say they wear masks, observations show about 59%, so under 60% of people wear masks, which means 40+% of people aren't wearing masks on a regular basis, even though they say they do. And again, masks are one of the tools we need in order to make sure that we can all stay as safe as possible. So a couple things with masks. One, CDC is now saying wear them, and I'll quote it exactly, wear a mask in public settings, like on public and mass transportation, at events and gatherings, and anywhere you will be around other people. Plain and simple. They're not really putting social distancing in that number. Just anywhere, anytime you can be around other people, wear a mask outside. Do maintain that social distance. Do wash your hands. Do open windows and ventilate as best you can. But remember, masks, extremely, extremely important. So again, to go over the headlines real quick. Number one, the numbers. We had the highest daily count we've had since the pandemic, over 77,000. Before that, the highest daily count was right around 75,000. 8.4 million cases, 224,000 plus deaths, unfortunately, here in the country. And that puts us at number 5 for the rankings of deaths per 100,000 people population. Number 2, excessive deaths. According to the CDC, right now excessive deaths are including COVID cases, but also people who neglected their medical care for reasons concerned about the pandemic and ended up dying because of heart attacks, strokes, cancer treatments, those types of things. And then the last one, masks. The CDC has changed the recommendation a bit to say masks should be worn in public settings, not mentioning whether you can social distance or not, which is what they had before. Now they're saying, period, in public settings, if you're around other people, you should be wearing masks. Let me see if you have any questions.
I just tested positive for coronavirus. Would zinc, vitamin C, and vitamin D help me out?
So I just tested positive for coronavirus. Would zinc, vitamin C, or vitamin D help you out? What I tell people is overall, you want to maintain normal levels of these vitamins. If you're maintaining normal level of these vitamins, then they should help out. If you recall, Dr. Fauci in an interview a few weeks ago said that he takes vitamin D, and vitamin D was the one he said, you know, it might be something you want to think about taking. And here's the reason. There was a study done in the UK, and the study came out saying that if people were vitamin D deficient, but in this study severely vitamin D deficient, they did much worse if they got severe COVID symptoms. Well, a lot of people here in the U.S. tend to be vitamin D deficient. So there's a couple things you can do. You can check your vitamin D levels and talk to your doctor about taking supplements. You can get more sunshine, but you have to be careful to avoid skin cancer. And or number 3, you can take vitamin D supplements. Again, Dr. Fauci takes them. As far as it's vitamin D. As far as vitamin C, it can help keep your immune system robust, but taking it, it's much like during cold season. Taking it when you have the cold isn't going to help you as much as taking it beforehand and making sure those levels are safe and appropriate levels. And the same with zinc. Zinc, it's plus and minus. Studies really haven't borne out whether zinc helps or not. But of those 3, vitamin D is probably the one that you want to make sure that you have sufficient levels of. And the best thing to do, again, is just, and I know it's boring, eat a healthy diet, exercise, those types of things.
If you're positive and then negative, are you now immune to coronavirus?
So if you go positive and then you go negative, are you now immune to coronavirus? The big answer is we simply don't know at this point, because what we do know is if you are positive for COVID-19, then more than likely you will develop antibodies. When it comes to antibodies, there are a couple different types. And just to give you a bit of science here, when you first start fighting off the virus, you develop these things called IgM antibodies. Those are the quick ones. They're kind of general antibodies. And then you start developing more specific ones called IgG. Those IgG ones take 2 to 4 weeks to develop after you get infected with coronavirus. And so usually you've recovered by then, but your body keeps those cells around for a while, and that gives you that built-in immunity. However, what we're finding out with coronavirus, if you had mild symptoms, you might not build as many of those antibodies. If you had more severe symptoms, you're more likely to build more, assuming your immune system is strong enough. We also don't know how long those antibodies last. It seems like if you have mild symptoms, they don't last as long as people who have moderate or severe symptoms. And the other thing we don't know, which complicates it even more, is what level of those antibodies do you need in order to protect yourself from subsequent infections of coronavirus. So having all that together, the big answer is we simply don't know. We think you have short-term immunity. We don't know if that short-term immunity is 4 months, 6 months, a year, the rest of your life. We simply don't know at this point and won't know for some time. Now, one thing we have found out is, again, if you have those IgG antibodies and they tend to go away, you have these other antibodies that are called helper or killer T-cell antibodies, different types, that can also help kind of give you your immune system a memory of coronavirus and can fight that off in the future as well. It's a lot of research going on right now to look at all this and find out exactly what this means and what it particularly means for you and your immune system. But the main thought here is that, okay, if you have coronavirus, you recover from it. Even if you get an antibody test and test positive for antibodies, even if it shows you numbers at high levels of antibodies, this does not mean that you still don't need to do the mask, the social distancing, the washing your hands, because we don't know what those numbers mean and we don't know how long it will give you immunity. The other question I get asked a lot is, well, I've heard that people have gotten reimmune or reinfected with coronavirus. a second time. Well, if you think about it, around the world, there's tens of millions of people that have gotten coronavirus. To date, there's a handful of people that have gotten second infections that we have verified. There's some people that have tested positive twice, but it's not a true second infection. It's still the remnants from the first infection. But for people who have truly got infected a second time, handful of people out of tens of millions of people, so it's extremely rare that that happens. So for the majority of us, the main point here, you need to protect yourself and others around you. Wear a mask, wash your hands, social distance, those things you need to do to keep yourself safe. But thank you for your questions. They've been wonderful as always. But again, looking at the numbers, the highest daily rate of coronavirus cases just happened yesterday, 77,000+. Compare that to July 29th when it was 75, a little over 75,000. And so we're getting that upswing in cases now. Looks like that's going to continue. Remember, cases lag by 2 weeks. And so if somebody gets infected today or they're not protecting themselves and they get infected, 2 weeks later they'll start seeing cases. Number two, excessive deaths. It looks like there's a large number of excessive deaths. Probably 2/3 of those are related to coronavirus. There's that certain component, though, that's related to other things, heart attacks, strokes, cancers, that they didn't get the treatment because they were worried about getting infected with coronavirus, and so they neglected going to the hospital or going to their doctors. So the message here being, hey, make sure you get your own health care needs. Of the different groups, Latinos had the highest rate of excessive deaths at over 53% increase in that number. And so everyone needs to be careful, but in particular them as well. And then number three, masks. The CDC is now saying wear a mask anytime you're in public settings, public transportation, around other people in any kind of gatherings, because now they're not putting in there, they used to say wear a mask if you can't social distance. Now they're not putting that social distance part. They're just simply saying wear a mask, which is essentially the bottom line to all this. And so remember, we're doing these things right now to hopefully help us keep safe as time goes on. And one of the things we found out about masks is actually there's an interesting study that just came out, and I want to talk about it for a quick second. Let me find it here real quick. But basically what they're saying in this study is that if we wear masks, it's some modeling, that if we wear masks, that according to this one group, that if 95% of people wear masks, then they could end up saving almost 130,000 lives by February. If 85% of people wear masks, they could end up saving 95,000 lives by February. And so think about that. Right now we're about a little under 60%. If that gets to 95%, over 100,000 people's lives could be saved between now and February. We're talking November, December, January, 4 months, 100,000 people's lives. If 85, so if you went up a little bit, then we're talking that 95% of people could be saved, lives could be saved. And so this simple thing, wearing a mask, can be a life-saving measure. So please don't forget that, especially when you're out and about, because you're not just protecting yourself, but you're protecting other people. And the important part is now at this time, we all have to think about protecting those around us. Extremely important. And that's the way we're going to get through this pandemic sooner rather than later. So my main message here, I want you to do everything you can to stay healthy, not just you, but your family, your loved ones, your community, as best you can. Make sure we get through this pandemic sooner rather than later. And as always, especially going into this weekend, I hope you stay as happy and as healthy as you can. Thanks.